Nous pouvons commencer. We can start, Mary.
The sound is too soft. I'm not hearing what they're saying well from that side. Anyway, yeah.
Good morning, all. Welcome to the WHO Africa Media Briefing. Today, we will be focusing on how cyclone is affecting people's health in Southern Africa. My name is Dr. Mary Stephen. First, some housekeeping. You can listen to the presser today either in English or French. To do this, please go to the bottom right-hand corner of your screen, click on interpretation and select your most preferred language. Khadija, please explain in French.
Donc, quelques informations pratiques. Vous pouvez choisir d'entendre la conférence de presse en français en cliquant sur l'image du globe en bas à droite et en sélectionnant votre langue. Is gone, Mary?
Thank you. And now joining us from Brazzaville is Dr. Matshidiso Moeti, the WHO Regional Director for Africa. And I'll turn over to Dr. Moeti to introduce our guest for today. Good morning and welcome, Dr. Moeti.
Thank you very much, Mary. So I'm wishing a good day, bonjour, bom dia, and welcome to all the journalists joining us for this press conference. Today, I'd like to provide an update on the cholera outbreaks in the region and highlight the health impacts of cyclones in Southern Africa. I'm delighted to be joined by Professor Zeli Arivelo Randriamanananti, the Minister of Public Health of the Republic of Madagascar. Professor Randriamanananti is leading his government's response to the health impacts of cyclones in Madagascar, which has faced 2 cyclones this year. Bienvenue, Monsieur le Ministre, et merci. Thank you so much for having joined us. In Africa, new cholera cases fell to 2,880 in the week ending on the 26th of February, and this was a 37, so almost 40% decline compared with the week before, when 4,584 cases were recorded. 12 African countries are currently reporting cases, with South Africa, Tanzania, and Zimbabwe being the latest to detect cholera cases. Lack of safe drinking water and also too much water in the form of flooding amplify the risk of cholera. I returned from a mission to Mozambique last week where I saw how cyclones can impact people's health. And then just after I left Mozambique, Tropical Cyclone Freddy, one of the longest lasting systems in the Southern Hemisphere, hit Madagascar, then swept through southern Mozambique with strong winds and high seas threatening neighboring parts of Southern Africa. This is the second cyclone Madagascar has faced this year. And in January, the country was hit by Cyclone Cheneso, which left more than 471,000 people without access to health services. The Honorable Minister will discuss the ongoing health emergency response following the cyclones, I'm certain. In Malawi, which is experiencing its worst ever cholera outbreak, increased rainfall is slowing outbreak control efforts in some areas, with response teams facing difficulty reaching needy people. In Mozambique, 55 health facilities have been damaged or destroyed, and more than 43,000 people have been affected by Cyclone Freddy. The country's seen a sharp increase in cholera cases since December 2022 amid the ongoing rainy season. Eastern Africa, for its part, has been affected by drought, which sends populations on the move in search of water and pasture, increasing the vulnerability to cholera outbreaks. The worldwide spike in the outbreaks has prompted WHO to declare cholera a global grade 3 emergency, meaning the highest in our internal WHO emergency response framework. Africa has had large outbreaks of cholera in the past. What is unusual is to have so many co-occurring and linked to major climatic events. A shortage of the oral cholera vaccine at the global level has exacerbated the situation. As part of the International Coordinating Group on Vaccine Provision, we are stepping up our support to countries. we've helped secure 3.4 million doses of the oral cholera vaccine for campaigns in Kenya, the DRC, and Mozambique. We're supporting countries to recruit short-term additional experts and staff to respond to cholera so that other essential services are not disrupted. In Malawi, as I speak, over 400 short-term staff have been recruited to support the running of cholera treatment centers. These frontline health workers must be protected from attacks as recently seen in Malawi, and we think these were due to false community perceptions of the outbreak. With the Africa CDC as a key partner, we are convening a high-level ministerial meeting hosted by Malawi on cholera. This forum aims to revive commitments to end cholera outbreaks in Africa and strengthen cross-border collaboration for its control. Over the past 2 months, in addition, 455 tons of critical cholera supplies, including intravenous fluids, have been delivered to Malawi and Mozambique, and to support preparedness in Burundi, the Democratic Republic of the Congo, Ghana, Kenya, and Zambia. In addition, we've supplied some ambulances to Malawi to help with referrals of severe cholera cases. Also, using imported and locally sourced supplies in Malawi, our logistics team designed, made, and operationalized 7 cholera treatment facilities with 164 beds. 2 additional facilities with a combined total of 50 beds are currently under construction. This will bring the total bed capacity that we provide to 214 and enable over 428 patients based on 2 patients per bed to be treated per week. We've deeply appreciated the collaboration of various partners in these efforts. Cholera, we understand, is a disease of inequity, driven mainly by inadequate access to safe, clean water and hygiene facilities, and of course, exacerbated by extreme weather events. The continent still has a high proportion of households with limited or no access to safe water and hygiene facilities. Therefore, preventing cholera and many other epidemics doesn't solely depend on the health sector. It requires investment in providing safe water and hygiene infrastructure, such as toilets. This multi-sectoral intervention demands collective action from several government ministries, local governments, municipal authorities, communities, and partners. So I'd like to reiterate our call for a coordinated national and global response, including equitable access to the available and affordable tools to address cholera and other diseases across the continent. Thank you very much indeed for joining us. Thank you and welcome again to the Honorable Minister from Madagascar, and I look forward very much to our discussions today.
Thank you very much, Dr. Moeti. And now turning to you, Honorable Minister, Professor Zeli Randiria Mananati. Can you please tell us how Madagascar has been affected by the recent storms? Welcome, Professor.
Merci pour ces mots de bienvenue. Madame la directrice régionale, honorable assistance, c'est avec plaisir que je me joins à vous aujourd'hui pour parler brièvement donc de l'expérience de Madagascar concernant les cyclones et les modalités avec lesquelles nous faisons face à ces cyclones. Ce qui a changé, en fait, ces dernières années, c'est que nous avons mis à profit les nouvelles technologies pour faire face à ces cyclones. Si auparavant, on n'avait pas trop accès à cette nouvelle technologie, notamment Internet, qui actuellement devient un outil de gestion carrément de la gestion des cyclones actuellement. En fait, actuellement, ce qui a changé par rapport à l'année dernière, vous savez tous que l'année dernière, Madagascar a fait face à 5 cyclones, dont certains ont eu vraiment une intensité élevée avec des destructions importantes. Cette fois-ci, ce qui a changé, c'est qu'on a mis à profit cette technologie, notamment Internet. Nous faisons un suivi de près de la météo. Et à peu près une dizaine de jours avant l'arrivée de cyclone à Madagascar, nous avons lancé une alerte au niveau national, puisque même s'il y a des changements en termes de trajectoire de cyclone, on a dit à tous nos directeurs régionaux et à tous nos médecins inspecteurs de suivre de près cette évolution du cyclone pour pouvoir faire face à cette cyclone, notamment en faisant des prépositionnements des intrants. Donc, toutes les maladies climato-sensibles, on a un service qui est dédié uniquement à cette réponse contre tout ce qui est catastrophe. Et donc, ce service a envoyé les médicaments et les intrants en prépositionnement sur toutes les trajectoires de ce cyclone. Et en même temps, on a dit à tous nos agents de santé de renforcer les infrastructures. Comme vous le savez, chaque année, un des dégâts, en fait, c'est que avec le vent, on a les toits qui s'envolent. On a dit à tout le monde de mettre en place des sacs de sable au niveau des toits. Et en fait, quand on est descendu sur place, à peu près 5%, moins de 10% des infrastructures ont été détruites grâce à cette, je dirais vraiment ce prépositionnement qui concerne uniquement non seulement les intrants, mais vraiment à la population de bien se préparer. En même temps, on a envoyé tout ce qui est moustiquaire imprégné d'insecticides de longue durée d'action, puisque Madagascar fait encore partie, malheureusement, de ces pays où vous avez encore l'incidence et la prévalence du paludisme qui est élevée. Et donc, ça nous a permis, je dirais pas d'amoindrir les conséquences de ce cyclone, mais ça nous a permis en tout cas de bien nous prévenir. En post-cyclonique, on a l'habitude d'organiser des soins de proximité et on fait la visite de tous les sites où il y a des sinistrés en fait, et il y a une équipe médicale avec les intrants qui font les visites. Comme ça, on suit de près la santé de toutes les populations. Si besoin, on fait des évacuations au niveau des centres hospitaliers, mais généralement, on arrive à soigner les sinistrés sur place. Merci.
Mary, I think you're unmuted yourself, please.
Okay. Thank you, Honorable Minister, for the updates on cyclone in Madagascar and all the early actions you've taken to mitigate the risks of this cyclone. Thank you for that. And now that we have heard from all our panelists, it is our time, journalists, to ask your questions. And to do this, please use the Q&A function on the Zoom platform. Tell us your name and the name of the media organization you represent. Again, we have additional experts that are on hand to answer your questions. We have Dr. Tiano Balde, who is the incident manager for the COVID-19 response. And we have Dr. Patrick Otim, the incident manager for the cholera response. So I will start with the first questions while we wait for additional questions on the Q&A. You could also alert us on the Q&A if you would like to go live with your questions. So this first question is coming to you, Professor Zeli, the Honorable Minister from Madagascar. What are the health impacts of the last cyclone Freddy? What are the most difficult health emergencies to manage during each cyclone in Madagascar? This is from Gaski Karane News. Honorable Minister, please.
Merci pour cette question. En fait, on a quelques maladies qui reviennent fréquemment chaque fois en période post-cyclonique, notamment les maladies diarrhéiques des enfants. On a également les infections respiratoires qui se transmettent assez vite. Et on a surtout tout ce qui est dermatose, puisque en fait, on a des... Enfin, c'est comme la gale, par exemple, mais on a d'autres dermatoses. Comme vous le savez, en période post-cyclonique, en fait, la qualité de l'eau change. Et à partir du moment où les personnes sinistrées se lavent avec de l'eau qui est non propre, en fait, ils ont des dermatoses. Oui, ils ont des dermatoses et ça cause des fois des lésions de grattage très importantes. En termes de riposte, en fait, ce qui est plutôt difficile à gérer, c'est surtout quand il y a beaucoup d'infrastructures détruites, notamment les formations sanitaires, par exemple, les centres hospitaliers où on a des blocs opératoires qui deviennent non opérationnels. On a des difficultés à avoir accès, par exemple, à des opérations césariennes qui font partie des soins de santé primaires. Et c'est assez difficile. Je pense que c'est cette partie-là qui est difficile, mais sinon, au niveau des maladies, habituellement, rencontrés lors de ces épisodes-là, nous avons l'habitude de le faire. Ce qui est bien avec la réponse, en fait, c'est que sous le leadership de son Excellence, Monsieur le Président de la République, nous avons un bureau de coordination qui s'appelle le BNGRC, le Bureau national de gestion des ripostes et des catastrophes. Et en fait, tout ce qui est aide humanitaire et tout ce qui est aide au niveau de la santé arrive au niveau de ce bureau. Et ce bureau couvre tout le territoire. Et donc, parce qu'un des souci auparavant, c'était la difficulté d'acheminer les intrants de santé au niveau des zones sinistrées, mais actuellement, on a réussi plus ou moins à résoudre cela grâce à l'anticipation avec les nouvelles technologies. Je ne sais pas si j'ai répondu correctement à votre question ou pas. Merci.
Merci, Honorable Minister, Professor Zeli. And now, I would like to give Dr. Moeti a chance if she wants to weigh in on the health impact of cyclones.
Thank you very much, Mary. No, I think that I think the Honorable Minister has responded to that question adequately. I mean, clearly, lack of access to safe water, diarrheal diseases, other infectious diseases, skin infections are some of the problems that affect children. And then quite often, not only do we have houses destroyed, but also we have health infrastructure damaged and sometimes destroyed by cyclones, as has happened in Mozambique, for example. And then this causes longer-term problems, access to health care for people. It means that governments and partners have to make alternative arrangements for ensuring that people continue to have access to essential healthcare. So I think we have direct impacts, and then we have indirect impacts that are related to impeding access to emergency and routine health services on people. That those can then exacerbate the immediate impact of cyclones.
Thank you, Dr. Moeti, for that addition. Now we will turn to Paul. Paul, are you ready to ask your question live? Paul from The Lancet.
Yes, thank you very much for this opportunity. So Dr. Moeti, I have two questions, and we've not been able to have a briefing since Ghana expanded expanded the number of regions where the malaria vaccines, RTSS malaria vaccines can be delivered. So I'd like a comment on this. And I also found out that there are plans to eventually make the vaccine to be available nationwide from early next year. So what are your thoughts, and what is WHO doing to support this rollout of the vaccine? And another question I have is on long COVID in Africa. I've been trying to track insight from the region on long COVID, but we've had shortage of data on long COVID as it affects Africa. So what does WHO know about this, and what is being done to ensure that we have more insight and the continent is better positioned? There are talks around empowering primary healthcare workers to be able to also deal with this, but we know that many health initiatives often end with the primary workers. What do you think would be a threshold to what the primary healthcare facilities can undo, and how do we avoid overburdening them with the impact of long COVID on the continent? Thank you very much.
Thank you, Paul. Dr. Moeti, over to you.
Yes, okay. Thank you very much for that question on expansion of access to the malaria vaccine, which is a very important tool that has been developed. And Ghana was one of the countries in which it was field tested, I believe. So we are now working with the government there to expand access to this vaccine. Just to assure that as WHO, we will accompany this process of supporting the rollout of the vaccine as it becomes more widely available in Ghana to the degree possible. We appreciate very much the fact that it was one of the sites in which it was possible to carry out field testing and to see how the vaccine can be rolled out, what could be the benefit from this public health tool. And therefore, it is now our collective wish and our responsibility to make sure that the children, especially of Ghana, benefit from this important preventive tool, even as research is going on to discover other vaccines. I'm not, to be frank with you, aware of the details in terms of scale at the moment. This is information that we could provide to you after this press conference from our colleagues who are working in this area. But just to very much emphasize the fact that we appreciated the opportunity to try out this vaccine in the field. We have learned how it can be rolled out. And as WHO, we are working with the government and other partners to support access to this important public health tool. Then your question about long COVID data in Africa. I mean, here again, we, as we transition in a way, we've transitioned out of the acute phase of COVID-19 and have been working on community surveillance in some countries of COVID-19 and are now more focused on scaling up vaccination to COVID-19. We need to continue to monitor people who have some form of COVID-19, particularly long COVID-19 data on the continent. This is an area, I believe, on which we need to put more effort so that those people who continue to have a need for support as this new manifestation of this illness evolves in our region receive the support that they have. In that case, then it would be our duty to continue building on the training that was already done with healthcare workers for them to recognize and manage acute, if you like, COVID-19 to save lives and minimize the complications. We would then need to see how those people with long COVID can be supported through the primary healthcare system to deal with the different manifestations of this disease. I'll ask my colleague who is the incident manager of COVID-19 to pitch in and see if he has any more detail than this. I think our focus has very much been on vaccinating now to exactly prevent people getting severe illness and possibly long COVID. And I thank you very much for bringing that to our attention. It's something that we need to incorporate on our kind of ongoing interventions dealing with the health impacts of COVID-19.
Thank you very much, Dr. Moeti. Dr. Tiano, your additional thoughts on the long COVID?
Yes, thank you very much. I think Dr. Moeti has really mentioned it quite very well. Just in addition, there have been some countries where we have registered most of the COVID-19 cases, and those countries are countries all from the Southern African sub-region, notably in South Africa. And definitely it's a situation where the cases of long COVID in that country has been, taken quite very seriously, both at the health facility level, but also at the community level. And you are absolutely right. There have been some training that we have conducted, in all of those different countries to allow some of the health professionals to recognize, the cases of long COVID. It's an ongoing process, but we just need to balance the real impact of the COVID-19 in our region in comparison to others. So it's an exercise that we are currently doing, and also we are doing a lot of effort, as you rightly mentioned, I think, Paul, the work at the primary healthcare level and also with the combination at the community, on the community response actions. Currently, we are implementing a kind of initiative for reinforcing the community response in about 20 countries in the region here. And part of it is also, integrate the clinical case management of COVID-19 cases, including the long COVID one. So ensuring the detection and also the continuum of care of people, at the community level, from the community level to the health facilities, including the people suffering of long COVID, is part of that exercise. So it's something that we are working on, and we need to reinforce on it. But again, just to take into consideration the impact of the COVID-19 in Africa, while also, assessing the cases of the long COVID. Thank you, and back to you, Mary.
Thank you very much, Dr. Tiano, for that useful addition. This next question is coming to you, the Honorable Minister. The question is coming from Dorcas from BBC Africa. What is the current plague situation in Madagascar? And what impact, if any, do cyclones have on plague? Honorable Minister.
Merci pour cette réponse. En fait, je voudrais avoir plus de précision. Quand la personne qui demande parle de fléau, de quelle maladie parle-t-elle ou il exactement? Ou simplement parler des fléaux post-cycloniques?
It's asking the impact.
Ah, d'accord.
Yes,
En fait, j'ai déjà répondu en privé parce que j'ai vu qu'il y a une réponse, enfin, il y a une question donc au niveau
okay, but we'd like to hear the minister as well.
Pour la... D'accord, oui, oui. En fait, comme vous le savez tous, Madagascar est un pays endémique de la peste. En termes de changement du nombre de cas, on n'a pas eu trop de modifications par rapport aux années antérieures. Et en fait, la question, j'ai deux questions. C'est quelle est la situation actuelle de Madagascar pour la peste? Et la seconde question, c'est quel est l'impact du cyclone? Donc, en fait, comme Madagascar est un pays endémique de la peste, on a plus ou moins les mêmes nombres de cas que nous avons annuellement. Ce qui a changé simplement, c'est que on a une accélération de la réponse en termes de riposte parce qu'on a un monitoring beaucoup plus rapproché qu'auparavant. On a mis en place un groupe WhatsApp qui couvre tout Madagascar, donc les intervenants. Et en fait, dès qu'on a un cas de peste, on a une réponse qui est assez rapide et en fait, on arrive à circonscrire assez rapidement ces cas-là. Pour l'impact de la peste, du cyclone sur la peste, à ce jour, notamment pour les deux cyclones qui sont venus à Madagascar, même pour l'année dernière, le cyclone n'a pas trop d'impact sur l'évolution de la... Merci.
Thank you, Honorable Minister. And this next question is coming to Dr. Tiano Balde, COVID Incident Manager. What is WHO doing about the persistent threat of bird flu pandemic? And what is the situation currently in Nigeria? Dr. Balde?
Thank you, Mary. I think it's not that much connected to the COVID, but since also it's a kind of disease which can affect humans. So yes, in Nigeria, we've been really informed about, the work on which is ongoing there, for really trying to address these threat around, the bird flu, cases. And the government of Nigeria is monitoring really closely the situation, and with the support of the WHO expert on this one. We know that this situation has really emerged in 2019, and since then, many cases of bird flu have been reported in almost 31 states of the countries, and which has also led to many, deaths of some of the of birds. But what is at least positive until now, we have not really seen a kind of large impact. To the people, to the human beings. So we are seeing a kind of circulation of the virus amongst the birds, but no really a major transmission to humans. Just in 2021, the Nigeria CDC reported around 7 cases of avian flu H5N1 in mostly in 2 states, but really those cases have not really shown a major clinical features and or severe presentation, clinical presentation. So at the moment we are really monitoring the situation, helping the government of Nigeria to assess the situation as much as possible, and then if needed be to take any necessary actions on this one. Thank you, and back to you, Mary.
Thank you very much, Dr. Tiano Balde. We have the next question from Lindsay from New York Times. And the question is about the impact of mental health on these kinds of disasters like the cyclone in Madagascar. And beyond the urgent response, what sort of psychosocial support is available? So I will start with you, Honorable Minister, to comment on this question. The impact of mental health on disasters like cyclone, and if we have any psychosocial support available after the response or during the response.
Oui, merci pour votre question. En fait, on est à Madagascar, tout ce qui est santé mentale, c'est un vaste chantier, puisqu'on est en train de mettre en place vraiment un programme d'envergure nationale suivant les dernières recommandations de l'OMS concernant la santé mentale. La santé mentale a été, je dirais pas négligée, mais n'a pas été trop prise en compte jusqu'ici. En fait, il n'y a pas uniquement pour le cyclone, mais c'est un vaste chantier au niveau national que nous sommes en train de mettre en place concernant comment dirais-je, les impacts psychologiques des cyclones. Généralement, il y a encore peu de psychologues ou de psychiatres à Madagascar. Et donc, en fait, quand on amène donc, ce soutien psychologique, on emmène des médecins spécialistes ou des personnes formées spécialement pour la psychologie, qu'on emmène des chefs de région pour faire ici on les appelle caravanes médicales. Et en fait, on emmène ces personnels de santé pour venir à la rencontre des populations pour discuter de tout ce qui pourrait être conséquences psychologiques. Mais jusqu'ici, ce n'est pas encore un programme d'envergure nationale, ce sont les caravanes qui disposent de ces compétences-là, mais nous sommes en train d'étudier sérieusement comment faire pour augmenter le pool de personnes compétentes en matière de santé mentale à Madagascar. Merci.
Merci beaucoup, Honorable Minister. Dr. Moeti, do you want to weigh in on the impact of mental health on emergencies?
Yes, I do briefly. I mean, we know, of course, that mental health impacts are part of natural disasters and situations like these cyclones and floods that are affecting some communities in Madagascar. And I'd like to just join the minister in indicating that in our region in general, mental health continues to be a challenge in terms of the capacities that are available in countries. I think the COVID-19 pandemic really demonstrated quite dramatically the importance of mental health and its connection to such crises as disease outbreaks or even events like floods. We are working with the ministry to support the package that they are putting in place to include mental health experts in the situation in Madagascar. We are also supporting the same in Mozambique. In Mozambique, where I visited, as I said last week, the government is putting in place a multi-hazard emergency center, and the plan very much is to include expertise in mental health to be part of the package that's offered in services there. We've seen in Zimbabwe, for example, during the COVID-19 pandemic, that there was training in quite a large number of healthcare workers. I think about 16,000 health workers were trained in how to provide psychosocial support. So this is a very important component of supporting community resilience and recovery from the trauma of such events. And it really deserves additional investment as part of the response to outbreaks and public health emergencies.
Thank you, Dr. Moeti. Dr. Otin, do you have any addition on this?
Thank you. I think Dr. Moeti and the Honorable Minister have mentioned most of the issues. I think what I wanted to reiterate, because in the early phases of the emergency, the provision of psychosocial support and psychological first aid is critical, and also ensuring continuity, especially for those who are already on medication, to ensure that the medications they could have lost during the cyclone are replenished, And so in Madagascar, for instance, with that proactive action taken by the ministry to pre-position essential medications in those areas where the cyclone was going to pass, was really critical in ensuring that people's medications are not that are lost are replaced. And then also that in the aftermath, when assessments are done, that we can be able to manage the initial psychological trauma and complications that come with the loss that people experience during this cyclone. And I think it's really, really important that going forward, I think building the capacity and training the healthcare workers at the lower level so that they can be able to offer the immediate psychological support after this cyclone, but then building the capacity for managing the severe cases and the referral pathways for continuity of care is very critical. Thank you.
Thank you, Dr. Patrick Otim, for this addition. And the next question is coming to you, Dr. Tiano Balde. This question is from Elizabeth from TV 47 in Kenya. The first question is, what strides has Africa as a continent made in tackling diseases? There exist challenges for persons living with rare diseases, including misdiagnosis. What is WHO doing to solve this? And the last question is, was the COVID vaccine the silver bullet in fighting COVID-19? Over to you, Dr. Tiano.
Thank you, Mary. I think also, as Dr. Moeti was saying, the COVID-19 also have teach us a lot of things. And about, these orphan diseases, I think all of the measures that we have put in place for trying to detect timely and effectively any type of signal of public health signal, I think in most of the countries, and not only at the national level, but also at the sub-national level, is something which is important. So any type of signal, public health signals, which can have a kind of, potential impact on the health of the population, I think really need to be detected. And the reinforcement of the capacities of detecting those signals is something which is very important, both at the national but also sub-national level. And we know also all of the investment, which has been initiated for really having most of the medical tools, diagnostic tools and means, and also, medicine and vaccine, for addressing, rare diseases or new diseases. We know that this is also something which is very important. And it's bringing us to the point about, these more investment definitely on the research, on the innovation for really trying to building more capacities locally in Africa here, manufacturing capacities for producing these medical goods and medical materials and means, to address any of these potential, issues. Now, coming back to the point around, the vaccine, we know that the vaccine is one of the tools, and we have seen really the important vaccine, COVID-19 vaccine, was really incredibly important, tool for fighting the COVID-19 pandemic. And today, if you are talking, it's really because of the importance of these vaccines. So they have played this crucial role. And today, as the pandemic is moving, is evolving, we really wanted now to focus a little bit more on the most vulnerable population, notably the people living with some of the comorbidities like hypertension, diabetes, or HIV, but at the meantime, also the elderly people. So we need to continue, obviously, taking all of the necessary measures for convincing people to continue to get vaccinated around the COVID-19, but at the meantime, also not to forget about all of the other response tools and response means, which have been, which have really shown a lot of effectiveness and a lot of efficacy, throughout the pandemic. I'm referring here, to the early detection of cases, once again, the early referral of cases, and obviously, taking off some of these community measures like the public health and social measures, to stop, the spread of the transmission of the virus. Thank you very much, Mary.
Thank you, Dr. Tiano. Dr. Moeti, do you have additional thoughts on this, tackling rare diseases and the COVID vaccine, whether it is a silver bullet?
No, I agree very much with Dr. Balde that we need to continue to invest in discovering and tackling all diseases, including rare diseases, which might then become not so rare, depending on what happens. So that really entails working together, investing in health, as national governments in Africa, together with our international partners, joining the various interventions to track rare diseases, to discover them, and to be part of discovering the tools that address them. There is a need to increase, scale up really the engagement of African countries and African populations in international research. And this is something that we, coming out in a way out of the COVID-19 pandemic, and the engagement in the fast discovery of new tools, that we are very much encouraging as WHO, and would like to support working with international partners and with continental institutions, so that Africa really takes our own place in the discovery of the diseases that are affecting populations here, and we become part of the process of discovering tools to respond to them. Magic Bullet, I would say it is a very important central tool in ensuring that we minimize severe illness, overwhelming of health systems, and loss of life due to COVID-19. We've seen the different variants of the virus emerge, and one of the constants has been that people who are vaccinated are less likely to get severely ill and are less likely to die. And I'd just like to reinforce what Dr. Balde has said. So we need now in our countries to continue to identify these people, to make sure that not only have they had their first series of vaccines, some of these occurred quite a few months ago, make sure that people continue to come for their boosters every few months as we learn more about this virus, to ensure particularly that healthcare workers who are most exposed if new variants emerge, elderly people, people with some illnesses, with obesity, heart diseases, people with HIV infection, diabetes, become infected. So what I would just like to end is to urge everybody, follow the information provided by the governments, because they do provide people with information about after how many months should you get a booster dose if you are in a certain category, and please do go. These are being offered free of charge in virtually all of our countries.
Thank you very much, Dr. Moeti. And we are moving to the next question from Columbus, from British Medical Journal. And this question is coming to you, Dr. Patrick or team. Is there any information available about the surging cases in Malawi or other Southern African countries?
Thank you very much, Dr. Mary, and thanks for this question. I think to start with, there has been significant progress made in the response in Malawi, and would like to thank the leadership of the government in Malawi. I think led by the president, he was the last 3 weeks championing the End Cholera campaign. We have noticed over the last 3 weeks, there have been successive decline in the number of cases being reported. So for now, epidemiologically, we cannot say that the cholera cases in Malawi are surging. They're actually on a downward trend, and we have had cases on the decline for the 3rd consecutive week, and the deaths have been declining as well. So it's really, really important that at the point where we are now, 3 out of the affected districts have not reported any cases for the last 3 weeks. So we can consider that those 3 districts are now under control. And now the focus is to, in the 5 hotspot districts where we have a lot of transmission, particularly in Lilongwe, which is contributing to the bulk of cases that we have seen. And even within Lilongwe now, the transmission pattern has shifted, that we are seeing more cases in the rural parts of the capital as opposed to the urban areas. So the response is shifting to target those areas. Now, in terms of the rest of the countries within the Southern Africa sub-region, I think the concern is in Mozambique because of the impact of the cyclone and the flooding which has been happening, which is facilitating transmission. So it's Mozambique. We're still seeing an increase in cases, and the response over the last 3 weeks have also been scaled up to be able to stem the spread from the provinces that are affected to additional ones, particularly in areas where we've had heavy rainfalls and flood. And Dr. Moeti, as she mentioned in her opening remarks, was there and they are providing support really across the 3 levels of the organization to the country to contain the spread. Now, the other 2 countries that have had cases reported in the last 2 weeks are Zimbabwe and South Africa. And these are very small outbreaks that are being responded to. We have not received additional cases in the last 72 hours from Zimbabwe and also from South Africa. So we are quite sure that once the response that has been rolled out in those countries to these new clusters, I think we can be able to contain them. The last one I will comment on is Zambia, which is related to the transmission in Malawi, cross-border spread to Zambia. And the country has been responding to this. We have also seen decline in the number of cases, though the number of districts have increased, but we have not seen an accompanied exponential increase in the number of cases. So we're also confident that the situation in Zambia will be brought under control soon. Thank you.
Thank you, Dr. Patrick Otim, on that update regarding the cholera outbreak in the Southern Africa sub-region. The next question is coming to you, Dr. Tiano Balde, and the question is from Sarah Javin. She's asking if WHOAFRO is participating in the setup of the Africa Epidemics Fund, and if so, what are the expectations about how this fund would evolve?
Thank you, Mary. I mean, for the past, years, in the regional office here, there is a fund, the public health emergency funds, for supporting the response, to public health emergencies. And definitely, if there are some new mechanisms, we might need, to see exactly, how to streamline and to coordinate all of the different efforts. But I can guarantee that, member state countries of Africa here has been contributing to a funds which is called usually the public health emergency funds for the African region here, and those funds have been really instrumental, very important in responding to the early stages of the response, notably the response here in the humanitarian situation in Ethiopia, in South Sudan, but also recently even in the cholera outbreak in Malawi. So the funds, they are quite managed at the regional office here, but definitely also really trying to help to kick off, and to have kind of timely response intervention, implemented in the different countries. Now, definitely we know, again, as I was saying, that there are different initiatives at the moment, both globally, but also in the region here for having some additional funding mechanisms for responding to public health emergencies, on which obviously I think we are welcome and we are welcoming, and on which also we are taking part of the discussions. But yes, that's what we can say on this one. Thank you, and back to you, Mary.
Thank you, Dr. Balde. This next question is coming to you, Dr. Moeti. The question is from Esther Nakazi. She's asking, what is the update on cholera vaccines being available to affected countries in the region? Most countries are cash-strapped in their cholera prevention efforts. Is WHO as a leader able to rally other partners to help these countries?
Okay, thank you very much. I think what I can say is that there is an arrangement at the global level to avail cholera vaccine supplies to countries. So we as WHO work within a global mechanism that enables countries to have access to these cholera vaccines. Certainly, the current situation of multiple cholera outbreaks has presented somewhat of a challenge to the availability of vaccine. And as WHO, we are continuing to work to make sure that as new cases arise or as new transmissions occur in countries, we're able to obtain the essential supplies that enable the vaccine to be an important part of the response with the vaccine. So we have a global mechanism of which WHO is a part with other partners, and decisions are then made on allocations of the vaccine based on the availability of the vaccine. I think the issue of financing for response to outbreaks in general is one on which WHO has advocated very strongly for pre-positioning of financing. My colleague was just talking about a fund that the previous regional director put in place with the contribution of member states, where we very much appreciated the fact that some countries have consistently contributed so that when there is a new outbreak or a public health event, we are able very quickly as WHO to provide some funding for the initial response, while a broader resource mobilization for responding to the outbreak happens. Indeed, there are challenges in member states having the financing to be able to do the entire response to an outbreak. We work as part of the international community, of course, to launch appeals, to mobilize resources and enable countries to have some of their resource needs responded to. We've been able to do that as WHO very much around the COVID-19 pandemic and other outbreaks that are happening. So it is very much a matter of mobilizing the resources, making the case, and the international community responding. There is a pandemic fund, I'm sure you are aware, being discussed now, where again, we will be relying on international solidarity, international financing to put in place resources that can help countries to build their capacity in advance of outbreaks, emergencies happening, and then of course have a mechanism for mobilizing additional resources in response when something happens. So it's a challenge, in my view, is something that requires the investment of national governments on the continent, the work around the fund that the previous colleague mentioned, which is being coordinated by the African Union and the Africa CDC, and international solidarity and some of the mechanisms that are being put in place now to both prepare and to respond to outbreaks, including, very importantly, making sure that other global funds that deal with different disease problems are availed to make sure that then we don't have an outbreak disrupting access to essential services like HIV or child vaccination. So all of this needs to work together.
Thank you, Dr. Moeti. Dr. Patrick, do you have anything to add on the mobilization of the cholera vaccine?
Thank you, Dr. Mary. I think Dr. Moeti has explained most of the issues around the vaccine. I think I just wanted to state one is that currently we do not have the stockpile. So in the previous years, there was a stockpile of the vaccines that countries could request and access from. So because of the multiple outbreaks and increased demand, the stockpile was exhausted. So the doses are being dispatched as they are being manufactured. And so globally, the capacity is only around 3 million doses that can be manufactured every month. So because there are other countries that are also having outbreaks, so when the doses are manufactured, the ICG, which is that international coordinating group that's responsible for the distribution of vaccines that Dr. Moeti was referring to, reviews the requests from many countries and apportions based on the needs. So African countries have been able to benefit. Kenya just implemented a campaign targeting 1.4 million people. Mozambique received 700,000 doses, which they are currently implementing, and we are working with them to submit a revised request for another over 1 million doses to support the response. So within the global constrained stock of the vaccines, we are at least able to get some doses. It is not sufficient to cover all the needs, but we are prioritizing for areas where we would derive the best outcome from the deployment of the vaccine. The second one is on the issue of the funding. And as Dr. Moeti had mentioned, we are working with the different partners and within the UN system really to raise the appeal for additional support. And I'm glad that, for instance, in Malawi, in response to the appeal that was launched, the Central Emergency Reserve Fund of the UN has allocated around $4 million for the response, which is currently being dispatched. And there are discussions ongoing in Mozambique and the other countries with the UN system and other multilateral donors to be able to contribute to this response. My appeal would be then that I think for us to come in solidarity with these countries to support them. Coming out of the COVID pandemic, the economies of these countries are also suffering and multiple public health emergencies being responded to. But cholera has a potential to quickly explode because of the short incubation period and the exposure that happens with contaminated water sources. So it's very, very important that we support these countries to be able to respond at the point where the outbreaks have not become too big, which will require a lot of resources to continue. Thank you.
Thank you, Dr. Patrick Otim. This next question is coming to you, Honorable Minister. The question is from Mafuji Sise from Remapsin, the Gambia. He's asking, has Madagascar used the COVID-19 medication they prepared? And if so, what is the result? And the second question is Madagascar using American or European produced COVID vaccine? Do you notice any differences between the two? Honorable Minister, sir.
Je vous remercie pour vos questions. Pour la première question, oui, Madagascar utilise donc la CVO et la CVO+, qui sont les remèdes fabriqués à Madagascar, comme vous le savez. En fait, notre stratégie, on attend un certain seuil de transmission au niveau de la population générale et en même temps qu'on fait les ripostes, on donne la CVO en préventif et on donne la CVO en curatif pour essayer de faire en sorte d'arrêter la transmission. Généralement, les constatations que nous avons fait actuellement, généralement à partir du moment où on met on donne cette CVO aux personnes contact aux malades de Covid, dans les 3-4 semaines, on arrive à maîtriser la situation. On arrive vraiment au niveau de transmission normale. Ce qui a été très spectaculaire, en fait, c'était l'année dernière, au moment où, en fin décembre, on avait une ébauche vraiment un pic de Covid. Et au moment où on avait réussi à commencer à maîtriser la transmission, les cyclones sont arrivés. Donc, du coup, on était obligé de mettre les populations dans des zones là où on met les sinistrés, par exemple, dans un site, on avait 5000 personnes entassées au niveau d'un gymnase. Il y avait une vingtaine de personnes qui ont toussé. En fait, on avait la PCR et c'était des personnes positives. Du coup, on a fait une distribution de masse de la CVO. Et en fait, en 3 semaines, on est arrivé à maîtriser une situation qui auparavant nous mettait 8 à 9 semaines pour arriver à cette maîtrise. Donc oui, actuellement, on utilise encore cette CVO. Concernant les vaccinations, comme vous le savez, à Madagascar, la vaccination n'est pas obligatoire. Les gens ont le choix soit de prendre la CVO, soit de faire les vaccinations. Concernant ceux qui ont fait la vaccination, ici à Madagascar, on a Johnson, donc les vaccins américains, et on a Pfizer-BioNTech, et les gens ont le choix entre les deux, mais jusqu'ici, on n'a pas eu trop de différences notables ni en termes d'effets secondaires, ni en termes d'efficacité. On a plus ou moins... on n'a pas fait encore d'études de sérologie pour voir les réponses vaccinales en termes d'évaluation des anticorps, mais en termes d'appréciation générale, on n'a pas trop vu de différence. Les gens ne se plaignent pas trop pour l'un ou pour l'autre des vaccins. Merci.
Merci beaucoup, Honorable Minister. And this next question is coming to you, Dr. Tiano Balde. IPCC anticipates more frequent and violent cyclone in the coming years. Has WHO made studies to anticipate and model the burden? Any mitigation programs on track?
Thank you, Mary, for this question. I think since the beginning of the interview here, I think Dr. Moeti has really highlighted the potential consequences of these cyclones or the natural, disasters which can affect our countries here. And definitely, there've been a lot of effort which has been undertaken by the regional office here of WHO for trying to prevent and also obviously try to also to anticipate the potential consequences of those natural disasters. And one of them is the establishment of a regional command center around the cyclones, on cyclones in Africa here, which is based currently in our hub in Nairobi. So we have kind of a good number of colleagues and experts who are currently working on that, trying really to anticipate and mitigate, the health consequences of the cyclones. For sure, we know, the consequences goes really beyond the health sector, but at least for the health consequences. So there are some mitigation measures measures which have been undertaken. I mean, especially with the positionment of different supplies, some of the trainings also that we are conducting in the countries which are most at risk. And since 2018, we have really seen this recurrency of these cases. Dr. Moeti was mentioning the cases of Mozambique, where, I mean, the country is still really trying to recover from the cyclone Idai, which affected heavily, I mean, the country in 2019. We remember all of the destruction of some of the health infrastructures there. So I think packaging, having a kind of holistic approach is currently what we are doing, obviously trying to monitor the information around, I mean, the severity of these cyclones and all the natural disasters with the meteorological services. I think that's the key. So that multidisciplinary approach for trying to mitigate both, I mean, the consequences, but also anticipating the consequences. And I think maybe just as a last point, beyond the health sector, again, as we're saying, there are so many consequences, economic consequences, social consequences, which we need to take into consideration also in our response to augment its effectiveness. But just to summarize, that WHO is really taking necessary steps for supporting our member state for responding to these natural disasters. Thank you.
Thank you very much, Dr. Balde. And that question was from Simon Rose from RFI. This next question is coming to Dr. Moeti, and the question is from Fanta from Radio Kledu. What is the place and role of science journalists in the prevention and control of pandemics? The role and place of science journalists in the prevention and control of pandemics. Dr. Moeti.
Thank you. That's a great question. I mean, clearly, science journalists play a very important role in providing information, in translating and interpreting information for the general public, and in facilitating the engagement, really, between people at the community, national level, and the experts working on preparedness and response. I think they really play a role in ensuring that people get the right information written by experts who are journalists. Sometimes scientists find it very difficult to translate the scientific knowledge into language that is accessible and understandable by people. So these experts really do bridge that gap and play an important role in helping people understand the basis for interventions, actions, the challenges. And I believe it's a huge service that can serve both the scientific community to disseminate information among ourselves with the general public, and the collective action then to anticipate, address, and respond to disease outbreaks, public health emergencies, really based on science. And we know with the current context where misinformation has been such a devastating tool to the response to many disease outbreaks and situations, that we rely very much on science journalists to carry the correct scientific information in such a way that it's understood by people, and to help in the dissemination of this and the search for solutions to such problems.
Thank you very much, Dr. Moeti. Indeed, journalists have an important place in terms of epidemics prevention and control. We are now coming to the end of the press briefing for today. We will turn back to our panelists to give us their final thoughts. I will start with the Honorable Minister of Madagascar. Your final message, please.
Merci pour la parole. Merci également pour cette occasion donc, de partager l'expérience de Madagascar. S'il y a quelque chose à retenir, en fait, c'est que la manière de gérer les catastrophes naturelles sont en train de changer. De plus en plus de pays africains, heureusement actuellement, de plus en plus accès aux nouvelles technologies. En fait, on entre dans l'ère de la médecine prédictive, où on a vraiment la possibilité, en fonction des données que nous avons, de faire une prédiction. Ceci, par exemple, pour les cyclones, une prédiction de tout ce qui est trajectoire, une prédiction concernant les vents, les districts, etc., qui vont être traversés par le cyclone. Et en fait, ça nous permet de nous prépositionner, de nous vraiment préparer pour faire face à ces catastrophes, y compris l'organisation des missions humanitaires ou des missions de santé vers les zones enclavées. Donc, entrons dans l'ère du numérique, entrant dans l'ère de la nouvelle technologie, comme ça, nous pouvons suivre facilement l'évolution au niveau du monde entier. Comme ça, l'Afrique sera de nouveau sur le premier plan au niveau international. Je pense que si on adopte cette nouvelle méthode, c'est vraiment je vais dire, une méthode pionnière que nous sommes en train d'expérimenter, mais ça a apporté ses fruits et j'espère qu'on aura d'autres occasions pour ce partage d'expérience si d'autres pays ont expérimenté les mêmes choses pour que nous pouvons, comme ça, nous pouvons faire une capitalisation des acquis pour que le continent africain puisse faire face de la même manière aux éventuelles catastrophes naturelles. Merci.
Merci beaucoup, Honorable Minister of Health for Madagascar, Professor Zeli. And now, finally, I turn over to Dr. Moeti to give us our final message.
Yes, thank you very much, Mary. First, I'd like to very much thank the Honorable Minister for having joined us, for having shared with us what action his country is taking. And I'd like to thank very much the journalists, colleagues for having joined us as well. I think I can't agree more with the Honorable Minister of Madagascar that we are starting to use, and we need to use more intensely and more consistently, some of the tools, scientific tools that are available to be able to predict and prepare for these extreme weather events, which have an impact on health and on development more broadly, and reinforce our preparedness and response to them, because some of the preparedness you can do in the short term and others you can do in the longer term. So, for example, ensuring that areas that are vulnerable, recurrently affected, are not where we continue to keep structures, buildings that then are destroyed, that played not only a key role as for shelter for people, but also public institutions, hospitals, and so on. I think we need to use this predictive information and the recurrent experience in countries to be able to do multi-sectoral planning and preparation to mitigate the impact of these extreme weather events. And I agree that the technologies that are available now that we can superimpose on information about possible disease outbreaks, about the kind of organisms that might trigger outbreaks in these contexts, are also what we need to combine in order to do the public health preparation for disease outbreaks related. And of course, all this will be linked to what we know about climate change, extreme weather events that might be coming as a result. So I agree very much that, and we would like to be part of facilitating exchange of experience, information among countries, and even better reinforced preparedness and multi-sectoral action to both prepare and respond to countries when these extreme weather events occur. And I'd like to congratulate and thank him for the action that's been taken by his country. And again, say a big thank you to our colleagues, the journalists, for joining us and for the work that you do in disseminating information about health.
Thank you very much, Dr. Moeti. We have come to the end of the press conference for today. I would like to thank all our great panelists, Dr. Moeti and Professor Zeli, our technical experts, the media, our interpreters, and everyone that made this possible. Thank you and see you in a fortnight. Have a nice day.